X made it through the 80s, from cassette tapes to dial-up to VHS, but one thing they couldn't leave behind: the virus that causes shingles, a painful blistering rash that can last for weeks and disrupt work and time with family. Doctors Leonard Friedman and Samantha Picking join us with more. Doctors, thank you so very much for taking time out of your busy schedules. For those who haven't experienced it, what is shingles like and how can it affect everyday life?
Yeah, it's a great question. Now, the biggest thing about shingles is it's more than just a rash. I mean, symptoms can include fever, headache, chills, and even upset stomach. And the pain from shingles can actually last for weeks. It affects your day-to-day life, as you said, so things like work, time with family and friends, it all can be disrupted at that point. It can happen at any time, no matter what you got going on in your life. So it doesn't care what's happening, it can impact you at any moment, regardless of weddings, graduations, major life events, whatever you have on the calendar.
Okay, well, I am like healthily terrified now. Doctor, thank you very much. No, so why are people who are 50 years and older at greater risk for shingles?
Yeah, thank you, David. This is Dr. Leonard Friedman. I'm a vaccine research scientist at GSK. No matter how well we feel, our immune systems weaken as we get older, and starting at age 50, the risk of developing shingles, it sharply increases. Shingles, sometimes called herpes zoster, it's painful and a blistering rash that's caused by that very same virus that causes chickenpox. And once you've had chickenpox, that virus remains dormant in the body and can reactivate years later, causing the disease shingles. 99% of adults 50 and older already have the virus that causes shingles inside their body. In fact, 1 in 3 people will develop shingles over the course of their lifetime. So age is one of the most important risk factors for shingles, and 50 is when that risk increases.
Well, I've had chickenpox, so I'm on that list. Okay, so why is now a good time for adults 50 years and older to ask their local Walgreens pharmacist about shingles?
Yeah, I mean, even though we may feel young and healthy well beyond our 50th birthday, the truth is that our immune system does start to weaken, and our risk for shingles increases as we age. So people may not believe that shingles will impact them or something that older people experience, but shingles is more common than people may realize, and about 1 million people develop shingles in the US every year. So as a reminder to Gen Xers out there who were born before 1976, you're at increased risk for shingles.
Okay, so are there other risk factors for shingles aside from age in adults 50 years or older?
Well, we talked about age being the most important risk factors for shingles, as most cases do occur in people 50 and older. Stress can also increase your risk. Additionally, certain health conditions like diabetes, chronic kidney diseases, and heart diseases, these have all been associated with an increased risk of shingles. So if you're 50 years or older, particularly if you have one of those health conditions, ask your pharmacist about your risk for shingles and about prevention.
Okay, right. So how can a good conversation with a Walgreens pharmacist make a difference in helping to prevent shingles?
Yeah, as I mentioned, it's so easy. Your Walgreens pharmacist is that accessible local healthcare provider that you can trust. So you can go in at any time, talk to them about your risk for vaccine preventable diseases like shingles, and they can help you guide those conversations and answer any questions or make concerns you may have. So for those that are 50 years or older, I really encourage you to ask your Walgreens pharmacist about your risk for shingles. Like I said, you can walk in today. You also can go to walgreens.com and schedule an appointment if you want to plan ahead.
Sounds like a plan. So where should people who are 50 years and older go to learn more about shingles?
Well, if you're 50 or older, ask your local pharmacist about your risk for certain vaccine preventable diseases, including shingles, and that's how you're going to learn more. We also have a website, easyvax.com, EASYVAX.com. And at that website, you can find a pharmacy and make a pharmacy appointment near where you live.
Fantastic. Thank you for your time, Dr. Freeland, Dr. Picking. We really do appreciate it. And folks at home, if you want to watch this segment again or others like it, just head over to First Coast News Plus.